Sanamukele futhi babukeli manje ke sekuyisikhathi sentandokazi yohlelo Yilungelo Lakho, it's your right. Simlethele lona la kumamba phambili SABC 1 eMzansi for sure. Mbukeli lolu ke uhlelo lwa wonke amalungelo enu. Uhlezi nomangcolosi uAlicia uNonhlanhla wakajali. Ungasifonela la e-studio. The numbers are 011-714-669 or 714-0670. Ungasithumela email ku consume@sabc.co.za. We are available on Facebook as well as Twitter. Now, Mbukeli, today we shine the spotlight on one of the most prevalent as well as disruptive diseases to the lives of many consumers, including men. Sikhuluma ngayo breast cancer. Yes, men can get breast cancer. Sibheke ke Mbukeli ukuthi isifo somdlavuza lona wamabele phecelezi yona breast cancer iphazamisa kanjani impilo zethu kanye namaphakethe ethu njengoba sazi ukuthi ama-treatments are often very expensive. Kodwa ke ngaphambi kokuthi singene shiqe ngodaba lethu ake siqale sibheke nanku umbiko esiwenzelwe nguMs Dube.
Isifo somhlaza webele asinamkhethe wokuba ungubani, ingabe awuswele, ungalihlwempu, ungangomhlophe okanye onsundu. Esisifo sihlasela nabani na. Asinamntu ulula okanye osekhulile kangangokuba asihlaseli basetyhini kuphela, sikwahlasela namadoda. Ingozi yaso enkulu inye kukungahlolwa okanye ukuqatshelwa kwaso kwangethuba. Umntu othuke sesikwizinga eliphezulu ukuba amelane naso.
We support the patient, we educate the patient, and we also counsel the patient. So we specifically are the breast cancer survivors working together to support the patients as they get diagnosed.
Uoma nowafunyaniswa ngonyaka ka-2015 ukuba uphila nesisifo uthi kubalulekile ukuba umntu asijonge ngelibukhali eziphonononga ukubona ukuba akukho zimpawu zalomhlaza emabeleni akhe.
I was diagnosed in a private hospital and they told me, because I didn't have medical aid, they told me that one session will cost me 12.5 and I had to do 8 cycles of chemo at the time. So the 12.5, it was times 8, and for the blood I had to pay 1.8. So that was that amount that I needed to pay cash in private. And then I had the opportunity to come in the public sector just to pay 75 rand.
Phantse wonke ubani osebenza apha bangamaxhoba esisifo somhlaza. Ebekukhe kwakho inkolo yokuba sikhetha kuphela abasetyhini.
Ngo-2014 ndaphuma iqhuma ebeleni. Andaliwoya ndazixelela uba ndigilwe licango okanye ndigilwe lidonga. Kuthe ethubeni ndalibona uba liyakhula. Xa ndihlamba ndimane ndilibamba. Iiveki ezimbini zingadlulanga ndayokwenza ibiopsy. Xa ndisiya khona ndafika sibabathi ngumdlavuza webele.
Ezo ziphumo zovavanyo zabutshintsha ubomi belinenekazi.
Ndandisebenza ngela xesha ndidiagnoswa. Ndithe xa sendisenza iqhumo kulapho khona ndaye ndehluleka khona ngoba ngelinye ixesha uphelelwa ngamandla uyayibona into enjalo, so ndabona uba andinokwazi ndavele ndayeka ndajongana nayo.
Okwaphoncuke kwesi sifo nguJeanette Nkabinde okwalitshantliziyo elisebenza kulo mbutho.
Simabuya ama-results bathola ukuthi igcwele ibele lonke.
Ukanti unyango lwalomhlaza luza notshintsho emzimbeni.
Ndaphuma inwele, inzipho zatshintsha, umzimba uyaluma, ndifila shushu mhla ndibilile.
Kanti ke nempokotho iye ichaphazeleke.
Ngiyabona nginenwele manje. Mase ngizosuka inwele nje like sasa or day after bazongimangalela abantu ngisafuna ukuzifihla nyana ngewiki, kumele uthenge iwiki. Kanti nokudla udinga ukudla kahle ene uba nama cravings. Kumele ugeze ene kunezinto oba allergic kuzo ongakhoni like insipho yakho le ogeza ngayo manje mase ku treatment uthola ukuthi ayisakuphathi kahle. Fanele uthenge special ointment yokugcobisa.
Kulonyaka eliphulo likhuthaza ukuba kusondezwe iinkonzo zohlolo nenkxaso kwabo barhanela ukuba banganaso esi sifo. Papa Machanga na Dube, Yilungelo Lakho.
Some inspirational stories noma ezinye zisithusa ngempela kuma survivors wethu lapha. Sibonge kakhulu kuPhaphama Dube ngalombiko asididiyele wona. Manje ke mbukela ukukhuluma kabanzi phela ngesifo somdlavuza wamabele nokuthi ke singasinqoba kanjani lesifo. Let's welcome our guests today. I'm very pleased to welcome our ladies today. Sinaye uSizodwa Sithole, yena ke obuya eCancer Association of South Africa, ispelwa CANSA as in CANSA. Sibe nayo no Dr. Noluthando Nematswerani, yena ke umele iDiscovery Health. Ladies, what a pleasure. Good afternoon, Ngenamukela. Welcome to the show. Sizodwa siqale ngawo. Sawubona.
Sawubona.
Kunjani Sizodwa?
Siyaphila.
Sizodwa, let's start with i-comment yakho kwi-insert ngaphambi kokuthi size ukuthi nenzani nina njenge-Cancer Association. I mean, what do you think when listening to such stories ukuthi ama-prices are very, very high? A lot of people cannot simply even afford i-treatment mayithola ukuthi use-diagnosed.
Okokuqala ngicela ukubonga nje ukuthi usi-invite lana sizokhuluma ngale ibaluleke kabi indaba ye-breast cancer. Tina as a Cancer Association of South Africa, what we do, sifundisa umphakathi, we educate the public nge-importance of ukuscreena kwamabele. You know, like we are saying, from the age of 20, every month after your periods, finally when the self-breast examination.
Okay.
Yeah, sine video abangayithola ku website yethu ababukeli. And also ne mammogram. Mammogram is like an X-ray yebele.
Okay.
Ikwazi ukubona ilamp or isigaqa sisekhona ungakasiboni. And ukhona udoctor lo
Uzosichazele.
And ayikho cheap, it's expensive. And we say educator ababukeli ukuthi njalo ngonyaka uhambe uyosihlola. Kanti uma ungakwazi uku-afforda ilento i-mammogram, you can go to a clinic bakwenze clinical breast examination.
Okay.
And it's according to policy ye-breast cancer ukuthi annually uyahamba uye-clinic uyacela ukuthi ucele bakwenze
ekliniki le kahulumeni.
Yes.
Okay, bazokwenzela mahhala.
Yes. But ngifuna Alicia ukusho futhi ukuthi if even we are a public patient who attend nje primary health clinic,
yeah,
if onesi bebona ukuthi khona abakusolayo bayakwazi ukukurefera uye e-secondary tertiary level kuma specialist. Ama-specialist iwona zothi abazokodela i-mammogram if udinga e-public.
Okay.
Yes.
All right, Sizodwa.
Yes.
No, hayi cha nenza umsebenzi oncomekayo kakhulu. Akuthi ke siza udoctor ngapha ukuthi asichazele ukuthi njenge-Discovery Health. I mean, Doctor, welcome. Awusichazele wena. First of all, i-comment kwi-insert. And then usitshela ukuthi nina njenge-Discovery Health, do you cover all those costs akade besho ngazo ukuthi they're actually exorbitant? Umzulu sisoqala isevava yethu yokuqala it was 12.5 i-session A1 and she needed over 8. For umuntu ongena medical aid, umuntu who's not on Discovery Health, umuntu who does not have access to primary health care. Uthini kena sis?
Yo, Alicia, ngiyabonga nami ngokuthi us-invitile lana ngokuthi this is really important. I think okubalulekile njengoba seyitshilo usisodwa ukuthi firstly umdlavuza webele, umhlaza webele kufanele ukuthi utholakale usemncane. Ngokuthi mawutholakala usemncane uyakhona ukuthi usikwe then umuntu aphole.
Okay.
Ma utholwe sekulate, i-treatment yakhona more complicated and more expensive. Usisi lo ebekhuluma nge-12.5 thina e-Discovery ewe siyakhavarisha across all plan types. Sikhavarisha from key care to our executive plan. But key care, for example, izoba ne-limited benefits.
Okay.
Ngokuthi obviously sikhavarisha lokho okukhavarishwa kuhulumeni namhlambi sisongeze kancane.
Okay.
And then kube khona amanye ama-plan type uthola ukuthi sikhavarisha up to 200,000 and then after that sikhavarishe ke in full but ama-treatments are limited.
And it's like that for most insurers.
Exactly, it is.
That's how it is.
It is.
So we can't single one out.
No.
City, these ones do not, or they take the full brunt of financing. It's not like that.
So kukhona into apha kwi-insurance esiyibiza prescribed minimum benefits, meaning that noba uya kweyiphi medical aid, you will have cover efanayo, which is the prescribed minimum benefit. And it is aligned with ama-guidelines kahulumeni nendlela i-patients eziya kwi-government sector ezizawu treatwa ngayo. Inkinga bengifuna ukuza kule ukuthi sisi ukhulume nge-12.5 times 8 cycles. Kukhona ama-treatment asondele, in fact amanye ayadlula nakwi-million. And that's why sisithi the sooner umuntu ayo-check ibele ingekafumaneki, asifuni uye sobona isigaqa. Fanele uye nje uziyela namabele akho ungaboni lutho, then wenziwe i-mammogram. Kwabanye abantu, depending on ukuthi amabele akho anjani, kwenziwa ne-ultrasound with lo mammogram. Ukuthi sibone ngempela, izandla aziboni yonke into, ziyeva, zizawufila maseyivakala, mara zikhona ezinye ezincane ezingazubonakala. So that's why i-screening sibaluleke kangaka.
Sizodwa, it's like i-COVID ifike yasikhohlisa yonke into, izinto ezibalekile, ama-HIVs or cancer nani. What are organizations afana ne-cancer wenu, like what are you doing to reignite that conscientization yabantu ukuthi bazi ukuthi i-breast cancer ikhona and it is taking the lives of, unfortunately, many women? And so khuluma ngamadoda, ugqirha uzosixelela ngamadoda.
Uyabona Alicia, into engifuna ukisho i-important yokuphila a healthy lifestyle. Ake singakafiki nje noku-screen, sigayide weight yethu, si-exercise. Akufanele u-exercise akudinga ukuthi uye ejimini.
Yeah, uyihambele nje endlini emgaqweni ema-steps.
We were just talking with a friend of mine ethi betshena umama wakhe ukuthi bahlale elokishini somewhere eThekwini ukuthi ababizana emgwaqweni bonke bafaka amateki
nama-tights
bahambe bawoke. That's exercise and eating healthy. You know, ukudla okunamafutha. Yabona nje, we need to eat healthy.
Sizodwa awibambe lapho, yabona masuthi eating healthy food, because abanye bazothi kodwa amajali uyazi isimo somnotho asinayo kwaleyo mali yokuthi siyothenga izinkwa ziyabiza. How do we get around that? 0117140669 or 0117140670. We're back shortly after this. We're talking breast cancer. Ningayindawo babukeli. We are talking breast cancer and we are making you aware of izinto ongazenza phela ukuthi uzama ukugwema noma ukuthi uhambe ukuthi uyothola wena uma ngabe phela unaso isifo somdlavuza wamabele. Ungasithinta la e-studio 0117140669, alternatively 0117140670. Once again, 7140669 and 7140670. My guest today, the lovely lady is Zodwa Sithole. She is the cancer head of advocacy CANSA, the association, South African Cancer Association, alongside Dr. Noluthando Nematswerani, yenake ovela at Discovery Health Center. All right, Sizodwa, we're talking about ukuthi abantu mawuthi nje kumele kudliwe healthy bazocabanga ukuthi hayibo sekumele ngiyongena ezitolo ezithize ngiyothenga ama-fruits and veg kabanibani la kubiza khona anginayo imali. Uthi singenza kanjani ukuthi sigweme ukuthi, because I'm hearing this and I want to doctor to jump in on this mawuqedile ukuthi this is more of a lifestyle disease more than it is hereditary.
Thank you. You know, you don't have to go and buy konke ukudla. La engadini yakuzenzela ingadi encane nje.
Basatshala nabantu ingadi.
So mina ngiyabagqugquzela ukuthi abatshale.
Yeah.
Imfino, ispinach, ucarrot, ubeetroot. Lezo zinto ziyavuma uma uyitshala. Nami lapha ekhaya nginayo ingatshalana yami encane.
Yeah. Siyakhona nokuyifaka kuma-stack uma ngabe uhlalele eflatini noma kuma-complex.
And ikona kudla okuhealthy. Uyabona nje njengoba sokuqalisa umbila.
Yes.
Emakhaya kuyagaywa kweziwe isinkwa sombila. So lokho kudla kudinga ukuthi uhambe esitolo. Enye into futhi babukele ngifuna Alicia ukuthinta kuyona.
Yebo sezona.
Indaba yokuthatha kakhulu lokuya lokuphuza.
Amanzi amponjwana.
Yebo kuthiwa we must really avoid alcohol, futhi ukuphuza kakhulu, nokubhema. Really, njoba kade esho uDr. Noluthando ukuthi healthy lifestyle iyakusiza ngempela, exercise enza sure ukuthi udla right. Ngiyazi izingane zethu today zithanda ama takeaways.
Yeah, kakhulu.
So thina bomama is our role ukuthi sibafundise labantwana bebancane a healthy lifestyle. So those are the things bengifuna nje stress away. Yes.
Siyabonga kakhulu. Maybe Doctor, just jump in there. I mean, we were talking of manje ugqiba usixelela uba 5% of ama cancer cases is actually hereditary. Yes. Now this is new information to me because we've always thought maybe it's a 50% chance ukuthi you were born okanye ikhona kokwenu and then you actually inherited it. Kanti cha, it's actually more of a lifestyle disease.
No, Alicia, that's why sihleli la sifuna ukuxelela abantu ukuthi this thing you can actually prevent it. Yes. It's preventable. Most cancers, about 50% of cancers are preventable. You know? So with breast cancer we say about 5% zezihamba ke uthi ugogo wayinayo, umama wabanayo, uanti wabanayo ezihamba ngalondlela. Mara kwabanye abantu most of the people fumanisa ngokuqala ubanayo ekhaya.
Wena,
which is why we say we emphasize ukuthi i-lifestyle gijima or ukuziwokela nje umzimba ungabikho overweight, ungabikho mkhulu, udle kahle, ungadla amafutha amaningi, all those things. So it's very important.
You're still going to give us more pointers about what are some of the things to avoid. Let me take our first caller ngoku uFumbatha all the way from Estenga ngasekhaya. Fumbata, welcome to the show. Singakusiza kanjani today?
Hey, ihamba isibhedlela bangithatha igazi manje ngazi iyakwazi ukuthi babone ukuthi unayo icancer noma bakwazi ukubona esibhedlela.
Okay, Butfumbatha usuyile esibhedlela?
Ihamba from isibhedlela.
Okay. Oh, abakakutshela ukuthi mhlambe yini engabi kuphethe?
Nginoshukela into eningi nelonde esini ngaphakathi ngangenza umsebenzi welding.
Oh, okay, baba. Okay, baba. Ngicela ulalele nje lapha kumabona kude wakho. Qhiqa, maybe just jump in there. Ubaba uFumbatha, I mean, he's a man, and this is one of the other pointers that we wanted to talk about. Abantu abaningi mesikhuluma nge-breast cancer bacinga uba i-affecta only women. Yes. Please speak to the fact that how it affects men and what are some of the things that men, njengotata uFumbatha, can actually do to ensure ubana they do not have breast cancer themselves.
Yeah. So ngenhlanhla ebantwini abangotata ayijwayelekanga njengasebantwini abangomama.
Okay.
Which is why masi khuluma ngokuscreena. For example, obaba ayikho i-recommendation ethi bona mabascreen.
Okay.
Whereas thina, because sinawo amabele okuscreena. Remember obaba
abanazo glands
ukuthi bayongeniswa ku-mammogram. Mara if ubaba khona into ayibonayo, let's say kusekhona isigaqa sibonayo esingaqhelekanga, okanye ekhaya kubo kukhona i-history of cancer, bona siyabacela ukuthi bathathele phambili bahambe bayozicheck.
Okay.
But in general ayikho recommendation ethi abantu abangobaba mabayenze njengoba sisenza thina abantu abangomama. Mara thina abantu abangomama once nje ufike kwezi ages of 40 and above, kuyafanele ukuthi manje soqala uzicabange ukuthi utesta kanjani, uscreena kuphi. I-mammogram definitely over the age of 50 you have to do it. And make sure that you go regularly. Ngokuthi kuyabonakalisa abantu abascreena ngaleso sikhathi iyabonakalisa idata ukuthi ngabo labo baphela sebene cancer engadiagnosewanga ngesikhathi.
Okay, and then what are some of the things that men could look for, so that we sigqibe ngeyamadoda? Uyatsho baba he's got diabetes and he's also got other amalokhuzana diseases. Yes. So could that be something that is contributing to maybe ukuthi ahamba ayoscreena for breast cancer?
No. I-diabetes ayo reason yokuhamba uyoscreena for i-cancer. So ebantwini abangobaba, that's why sisithatha i-family history strong ye-cancer kuqala, and then mabebona something, because there is no recommendation yokuthi mabahambe bona bayoscreena njengabantu abangomama. So if uyabona ukuthi umdlavuza ilento ibele lakhe ingathi alikho right, kukhona iqhumanyana,
okanye
kukhona ipenanyana, kukhona mhlawumbe into engathi yaphuma nala ebeleni, kunyanzelekile ukuthi ahamba ayocheck.
So Zodwa, I mean, jump into this. I mean, let's go into this.
Yeah.
Please add to what Doctor was saying. Yes.
And also ko baba mangabe ekhaya kune history yokuthi mhlambe your son, your brother, your ubaba wakho died of has prostate cancer, your chances also are high ukuthi even abo mama bathi ene if ubaba, your son or your brother ube ne prostate cancer, your chances are high ukuthi ube ne breast cancer.
Oh, okay. Yes. So those are just things that we need to do. But I mean, the stigma that is attached to this gqirha, it's very hard to speak about it, even for people to go ukuthi bayotest. How do we then deal with that? Uba this is actually for the benefit of health yakho.
Yeah. And Alicia, I see some stigma more than fear.
Fear, ne? Because people think they hear cancer, but
mara the moment usithi kungcono ungazi uyazibulala ngalendlela ukuthi by the time so sithi okay ndiyaya sifike I mean sibone ibele liphelile uzibuza ukuthi umuntu ebehleliphi isilonda sivulekile
sithe please hold that thought mbukele yo this is getting very very interesting mangabe nawe you have ama symptoms ongawazi around amabele akho or ukhona umuntu enimaziyo ngasekhaya please do call us 0117140669 alternatively 7140670 we'll be back shortly after this ningaindawo. Mbukeli ongumthengi wena ke siyaxwayisa namhlanje ukuthi uma usuzithola usenkingeni ngokuthi family member noma wena seni diagnosed nge breast cancer which is our topic today iziphi izinto ongazenza uyasho ke udoctor uyasho noSizodwa ukuthi I lifestyle disease le 5% of ama cases iwona hereditary which means iya preventeka ilokhuzana icancer. There's certain things you can eat, there's certain things you can do ninga exercise to ensure ukuthi you minimize the risks ukuthi ni diagnose because once you get diagnosed sizwile ke insert ukuthi kuyabiza ukuthi uthole I-treatment if you are lucky enough to even be able to be diagnosed. Sisinomangesi all the way Eastern Cape Ntokwazi siyakwamukela ohlelweni. Thank you so much for staying on the line. Singanceda njani today?
Molo sisi.
Molo mama njani?
Ndifona ndiseSomerset East ne?
Yebo mama welcome.
Ndiqonda mani mna elibele lami lise left xa ndilicudisela kuphuma into engathi ngumthubi ne? Noba uyaqonda umthubi ne?
Yebo mama.
Yes, kwebili lapha right phaa ngoJuly eliphuma into engathi igazi kubona idischarge xa indaka.
Yebo mama.
Yayilo gazi in fact but kuphuma nje into engathi ligazi.
Okay.
Ne? And ke ngoku beline pain elili lapha right. So bendiyile kugqirha ogqirha khange babone into but ipain isekhona and after ke ngoku bendiyile kugqirha ibiphuma kwakhona lanto ingathi ligazi.
Sisinomangesi ugqirha ukwenze yipi exam if ungasixelela mama if ungasibalisela?
Ugqirha undisile pha kwilantuka.
Kwi-mammogram?
Yes, kwi-mammogram ne?
Okay.
Khange kubone nto.
Okay. And then ke ngoku
akho nto ndiyifumeneyo kugqirha for uklina mhlawumbi amabele if ayaklinwa okanye iipilisi ze-pain yonke loo nto leyo.
So ubuyisele emva nje endlini khanga akuxelela uba ubuye uzofumana okanye uhambe uyojonga elsewhere uba yena akafumani into kwi-mammogram?
Akhange sisi even i-results zami undichazele ngefowuni.
Wow. Okay.
Uyaqona akhange andichazele nto.
Okay sisinomangesi sicela umame lapho kumabona kude wakho ithi ndithi ugqirha this sounds very very concerning. Umama use Eastern Cape we're talking about conscientization yabantu especially in far-flung rural areas, inaccessible areas abantu abanganayo ne-TV leyo uba babone ukuthi where can they go. Umama is in a serious position here. She's oozing pus from Inansika and ugqirha went for a mammogram but they can't see anything.
So I think ekuqaleni ndiyabulela kakhulu sisinomangesi ngoba ufonile andazi iminyaka yakho ithini kodwa ke into ebalekile ukubana umhlaza webele ayiloqhuma kuphela. Xa kubhlungu i-discharge ikhona ingakumbe engathi negazi ngamanye amaxesha bengathi ibele lichile ibe ngathi you know ingono le itsaleke zonke ezo zinto zimpawu zoba ikhona into eyenzekayo apha ebeleni. Xa esithi uyile for i-mammogram but i-mammogram ayifumenanga nto andifuni uba ahlale athi akukhonto ngoba siyazi ba i-mammogram ngamanye amaxesha xa incinci umhlaza wakhona i-cancer yakhona mhlawumbi ingangabonakali nakwi-mammogram.
Okay, so in a state sokuba ibe undetectable
ingangabonakali. So i-mammogram nayo ngamanye amaxesha ingamisisha some of umhlaza osebeleni. So usisi ngobana kusekhona into ephumayo and kusekhona ubuhlungu. Ndiyacela uba abuyele, andazi babeyenze phi i-mammogram yakhe, but ingathi angaphinde achekwe futhi.
What ubese ku specialist? Remember we're speaking to her off air, and if a specialist simbuyisele ekhaya but unale nkinga and she's still got ongoing pain, angayaphi gqirha? Where can she go? Can she go to a local clinic okanye government hospital?
Ndiyacela uba abuyele if akanayo i-medical aid, ndiyacela abuyele noba kuse-clinic uba bemane becheka. Ingxaki into yobana if liselincinci usemncinci umhlaza bangangawuva ngesandla. Mhlawumbi nalo mammogram ndiyacela uba ingathi engaphinde emva kwexesha ayiphinde i-mammogram sizobona uba kwenzeka ntoni.
Ke ngoku what does she do? She's in pain, inantsika iphuma igazi. Like what can she do? Like really rush back to esibhedlela?
Makabuyele, ndiyacela abuyele. Akana ngoba ikhona into engerayithanga.
Okay.
Ikhona into engerayithanga, kuyafuneka ayazi uba yintoni. Ngamanye amaxesha ngenzeka uba ayiyo i-cancer. Ngoba asifuni ukuthi yonke into yi-cancer. Kodwa asifuni ubana kuthi kanti yi-cancer abehleli nayo. Ingakumbi ngobana khangahlale uye wahambela phambili.
And she wasn't given any results.
At least bamnikeze ne-painkillers, but udinga uba monitorishwe very closely.
So Zodwa, I mean, maybe khawusixelele, what are the statistics that we're looking at in South Africa as breast cancer? I mean, khawushocking amandla ngezi numbers.
Uyabona umubuka i-breast cancer kuma-cancer phatha abantu besifazane yona number 1.
Are you serious?
Yes, number 1. But when it comes to abantu abashoniswa i-cancer yesibeletho.
Okay.
Cervical
cancer, yes.
Engithemba ukuthi ngayelanga sobuya sokhuluma ngayo.
Absolutely.
And I was just reading statistics, but ngo-2018 abantu statistics abantu abatholakala ukuthi bane cancer eSouth Africa. I'll check my numbers now. There were about 14,000 abatholakala ukuthi bane breast cancer, and abashoniswa i-breast cancer 5,000. You can see ukuthi ama numbers makhulu kanjani.
But what does that say then, Gqirha? Does it say ukuthi breast cancer you can actually, if caught in time, as you were saying, iyalapheka? Ngiyazi kunama-double mastectomy where they remove both of your breasts if kuguthi it has spread to the other breast. So there are options, but you have to have the will and the know-how yokubana uhambe and get yourself checked early.
No, definitely. And I think that's why nsithi uyabona kula manamba kasisodwa. If singabhekisisa uzothola ukuthi most of the people there but itholwe sele ihambile, sele ihambele kakhulu, sele kunzima ukuyitreat.
Okay.
Can I just say something?
Yes,
those are the estimates. In South Africa at the moment, we see underreported statistics said. Ngizokutshena ngoba we are using i National Cancer Registry. And loma cases afakwe lapho kwi-registry. Ama-cancer la icubi zithathwe zaye e-lab. But mangabe u-diagnose wangaye e-lab, kusho ukuthi inamba yakhe ayingenanga.
It's unreported.
So something is being done. They are working on it, and we as cancer, we are supporting that. What is called, it is a population base.
Okay.
Yes.
Okay.
So it's underreported, and these numbers, is an estimated Pumagwi Globacon.
Okay.
It's not real. So South Africa is known as
yes. Okay, so let me take Anonymous. Anonymous, welcome to the show. Singakunceda kanjani namhlanje?
Yebo, sanibona njani?
Kunjani sis Anonymous, siyaphila wena?
Siyaphila nathi.
Singakunceda njani?
Ngizocela mina ukubuza, ngiye ngaba ne-cancer yesibeletho 2019.
Okay.
Ngayitreat-a ke ngahamba isibhedlela eMaritzburg.
Okay.
Ngenza i-therapy, ngenza i-chemo.
Okay.
Bangidischarge ke ngoba ngiye ngaya eThekwini ngayo thini khona into ethize yakhona.
Okay.
Then ngicela ke mina ukubuza ukuthi ke njengoba sekuneminyaka mhlawumbe I think 4 years ago ngingakwazi yini ukuphinda ngicheck okanye ngingathini nje.
Okay, all right. So in kule 4 years when us is anonymous, since ugqibela therapy when you were diagnosed and you were taking it, and it's been 4 years, you haven't had any pains or anything?
Yes, ngiyenzile yonke into bamdischarge ngaba right.
Oh, okay. So we survive kahle
kahle. COVID cancer ingaphindi ibuye back but angazi ukuthi ngenza kanjani.
Okay sis anonymous sicela ubuke lapho kumabona kude wakho udokotela noSizodwa bazokuphendula emva kwaleli khefu umbukeli nawe uma ngabe you find yourself in the same situation. Do give us a call 011 714 0669 alternatively 714 0670. We are talking one of the most silent killers of which ingalapheka bafethu breast cancer. Do call us. We're back shortly after this break. Ningaindawo. Welcome back. 011-714-0669, alternatively 714-0670. Those are the magic numbers. Umofuna ukuthi sikusize mbukele uma ngabe wena ke uyawazi umuntu noma uyasola ukuthi ungaba ne breast cancer noma nje ufuna ukuthi uwazi ukuthi how do you keep it at bay, because as my guests have said today bayasho ukuthi ezinye izinto ungazigwema ukuthi ungatholi cancer. My ladies, my guest today uSizodwa Sithole. She's the head of advocacy at the Cancer Group, as well as Dr. Noluthando. Nematswerani, yenage, she is from Discovery Health Center. Okay, Doc, uyasho anonymous uthi she had cervical and lokuzana cancer, got chemo, got treated, but now she wants to know ukuthi yini angayenza ukuthi to keep it at bay, because maybe uSizodwa uzosichazela ukuthi iyenzeka indlento, and how common is it ukuthi once you've been treated for cancer one iphinde ibuye futhi in the exact same way in the same position. And we hear apparently misibuya Sizodwa it comes back more aggressive, but let's hear from the doctor.
Yeah.
Doc,
so I think anonymous firstly because uthi utritiwe ngiyathemba ukuthi isibeletho siphumile, so the only thing yena kukuthi nje continue ishe amane esiya befamba mawuqeda treatment awuvele ukuthi uhamba nje.
So aftercare maybe ama specialist wethu nabantu abasebenza ngabantu they need to be giving more information. Yes, doctor.
Akwenzeki ukuthi ube ne cancer ukuthi uhamba ke
ukuthi uhamba you are healed.
Fanele ukuthi yes sitreatile yalaphekile mara manubuya sizomane sikuchecka. And then ke yena because isibeletho senziwe watreatwa mara ngakhohlwa ukuthi amabele asekhona.
Can it move from one place, doctor? Uyifumanisa kuba sebekhilile from the cervical one and then usifumanisa ke ngokuba isiza ngezinye izindlela.
Yes, kukhona abantu esibaziyo ukuthi umuntu uba ne cancer is different. So awunawuthi because ngitreatwe cervix manje yesibeletho idlulile it means mina ngeze ngiphinde ngibe ne cancer.
Okay, let's take our caller uDumisile. Dumisile, welcome to the show. Sakwamukela sicela usibuza umbuzo noma umbono futhi usitshela ukuthi usifonela from kuphi.
Ngise Hammersdale KZN.
Use Hammersdale KZN. Okay, sis Dumisile. Singakusiza kanjani namhlanje ntokazi?
Uma wami usehambile ibhedlela. Wayihamba neclinic. Manje bathi ababoni lutho.
How? Ama-symptoms sidumisile niwabona ngimahlambi imaphi? Iziphi inkomba ezibonisa ukuthi uyagula?
Inkomba ekhona ezibonisayo ukuthi uyagula uma abuhlungu amabele, sekubuhlungisa imithambo. Kuyashisa njalo kubuma ukuthi enzenjani, kubuhlungu yonke indawo. Ubuhlungisa imithambo yakhona emabeleni.
Hayibo, uma uneminyaka emingaki sidumisile mesingabuza nje?
Uma wami usenawo 58, uno-68.
Una-68. Okay.
Yep.
And then wena njengomntana uke wazama ukuthi mhlawumbe umthathe umyise la kuzothiwa bayomenza khona ama-test amabele mhlawumbe nabuya nolwazi oluthize khona?
Hayibe akukho la bengisasukumile ngamisa khona. Sicike ngokuthi nje ayesibhedlela eArkhikani.
Oh, into emqale nini sithanda sami?
Ayisekunesikhathi nje side.
Unesikhathi. Oh, okay sisidumsile. All right, siyabonga kakhulu.
2008 ma. 2008
Go 2008. Okay.
Yep.
Maybe asiqaleni lapho Sizodwa siyabonga sesidumisile siqala ulalele lapho kumabona kude wakho. Sizodwa maybe jump in there ukuthi you know naba abantu they want to take ama initiatives but it just seems like the relevant information ayitholakala intokazi. Banithola phi nina because nina ngiyazi ukuthi niyabagqugquzela abantu ukuthi bahambe bayotesta. You can even locate ama lokhuzana ama oncology centers abaseduze kwabo. Singabasiza kanjani?
You know, that's another problem. Increase in the abantu babe ne-cancer. A lack of information. You know, especially abantu abahlala kodwa Hammersdale ngiyakwazi Hammersdale is not rural. Abantu abase rural kakhulu.
Okay.
But can I respond kusisi lona?
Ngicela respond ma.
Mina sisi usisi bani kamba
Usisidumisile.
Sisidumisile. Mina ngathi hambe e-clinic. Ngoba kune referral system ngeke uzujumpe uye secondary or tertiary uye clinic nifike nibatshene inkinga kamama ukuthi yini.
Okay.
Then sister bazokubhalela incwadi bazomhlola bampotoze nabibele mangabe bethola something bazomreferela kuma specialist kwenye level bengifuna ukusho njalo.
Okay.
Ukuyela back embuzweni wakho real information abidingeka and ngelanguage abantu understandayo especially umuya le emakhaya noma ikhona ibhalwe ngeEnglish mingayazi English ke ngenze njani and nanokuthi mingakwazi ukufunda nje mhlambe kube nama video adlala ukuthi mengisahleli le clinic ngibone ukuthi oh okay.
Speaking of a video yazi I'm sure sinayo ilokhuzana video ene self examination test la but maybe doctor take us through ukuthi how does one then like literally siyabona nansi la kumabona kude we testa kanjani just to find maybe izinto ongayijwayele within your own body because we all know our bodies.
Yeah. Okubalulekileyo before uzipotoze ukubona amabele akho.
Okay.
Uyawazi ngithi amabele akho
angakanani.
Uyawazi ukuthi angakanani, uyawazi ukuthi ashapeke kanjani, uyazibuka lapho uyazibheka ngokuthi makukhona izinto like if ingono itsalekile or kukhona indawo engathi ne deep uyabona ukuthi hayi lamabele awasahlelanga kakuhle so ngokubheka nje kufanele ukuthi uzazi umzimba wakho because awuzubona makurongo if awuzibheki.
Yes.
And then ke ngoku mawusenza i-breast exam kufanele kulale phansi and then uyaphakamisa la usebenzisa the palm awuthi
ngoba ngeke uzuzwe lutho.
And usizodwa uye wakhuluma ukuthi ngamanye amaxesha ngithi siyazi ukuthi during icycle yakho andithi mawuzomensa
I was about to ask ukuthi they change and ziba soleni
abelampi ngamanye.
So it's not a good time ukuthi uzicheck during that time
so ungathi hey manje senginoyira malamba so yazi ukuthi ngecycle yakho ayatshintsha but wazi ukuthi uyakhona ukuzibheka ubone makutshintsha ikhala usqueeze ubone ukuthi khona into ephumayo mara abantu nje ukuthi bajwayelana nomzimba wabo.
Okay.
And then ke umzimba wakho
and ungawusabi also because uzothi mezithinta ezukuthi kuna something usezophenika umuntu ahamba ekogooglisha izinto and then bese kuba back to that stigma esazokhuluma ngayo. Yes gqirha.
Okuhlekisayo ke sis Alicia ukuthi obaba bawazi imizimba yethu kodlula thina.
Oh yeah.
Cancer yiyo etholwa ngabo. Ngempela yebele ikutholwa ngobaba.
So they can even do couples testing ukuthi the male mangabune partner.
Siyabakhuthaza ukuthi ibe ngabo nabo abamane becheck ukuthi amabele asahleli kahle.
Okay bobaba siyazwa kusho odoctor akusho ngomina ugqirha uyasho lana nasizodwa bathi sizani because thina so mama sizofuna ukuzithi sithinte sibambe singaqedi ngoba siyasaba so nina ke obaba engathi nizoba ama specialist ukuthi nisize ngaleyo meko. All right, asithathe usis Virginia all the way from Cape Town. Virginia, thank you so much for staying on the line. Can we please how can we assist you today?
Mama.
Yebo mama.
Mama ndinengxaki yebele libhlungu so njengoba libuhlungu njena lide liza apha engalweni apha egxalabeni.
Okay.
Ibe ngathi liyadonseka so njengoba ndinto othatha i-treatment ye-high blood ndiye ndifike nditsho phayana eclinic
ewe
kungabikho nto yenzekayo abayenzayo
cha base bandinikeze ezopilisi kuthothomale nje lumzuzinyana.
Sis Virginia bakhe bakujonga. Sis Virginia bakhe bakujonga directly ebeleni xa ubaxelela uba nansi ingxaki yami ndiyakubona lokho kunye kweshukela but nansi ingxaki yami kubhlungu apha uke wabaxelela.
Ndiyabaxelela mama, ndiyabaxelela, ndiyakhomba apho kubuhlungu khona, ndibaxelela ndithi ene xa ndibamba apha ekudibaneni kwebele nekhwapha eli ndiva uba kubuhlungu kuyaqaqama bengathi ndiyadonseka.
Okay, Sis Virginia, if ungandixelela nje, how old are you? Iminyaka yakho emingaki sesi4 ugqirha ukuba akwazi uba mhlambe i-advice azokunika yona izofanela umuntu futhi oku-age yakho ma?
I-52 ma.
Okay, una 52. Okay, all right. Okay, so abakakunikezi any other treatment plan except lo bosuloko uyela for i-diabetes cha?
Bandinikeza ezi high blood kuphela mama, ayikho ekuyenye endisentsho ndibona zisoloko zifana ipilisi ezabanikeza zona.
Okay, and then Sis Virginia, ibele lilodwa leli elikunikeza i-problems okanye yiwo womabili?
Liwesi elalapha left.
Okay.
Elalapha right liyavakala naloba ikhona inkinganyana ekhoyo kodwa alifani nelilalapha
right. Okay, inkosi Sis Virginia ngicela umame lapho kumabona kude wakho ogqirha bazokusiza noSizodwa bangakuxelela uba mhlawumbe uphuma njani uyapi uzokuthola ukuthi ufumane usizo. All right. Okay, enkosi mama 0117140669, that number once again 7140669, alternatively 7140670. Those are the magic numbers. consumer@sabc.co.za sikhona futhi on Facebook as well as on Twitter. I will be reading your comments when I come back after this break. Ningayindawo, breast cancer awareness siyanixwayisa. Please do the following things. We're back shortly after this. Bukeli, welcome back. We are talking breast cancer awareness nokuthi iziphi izinto ekumele uzenze mangabe wena noma omaziyo womndeni ngoba siyazi ukuthi i-treatment iyabiza ngempela to the lucky few that even have access to low treatment. Ngihleli noSizodwa Sithole, she is the head of advocacy at the South African Cancer Association, kanye not Dr. Noluthando Nematswerani yenake, she's from the Discovery Health Center. All right, so let's take uMathapelo before siphendule Sis Virginia Cape Town. Mathapelo all the way eProtea Glen. Sakwamukela sisiwami singakusiza kanjani namhlanje?
Okay, sisi mina I'm a 42-year-old.
Okay.
And ekhaya my dad died of lung cancer.
Okay.
2 years ago, and from March this year ngingaqala ukuba nama-pains from both my breast.
Okay.
But I didn't really take it too hard until diploma some liquid.
Okay.
Then I thought I was pregnant.
Okay.
I tested, it was negative, I think twice. Then I went to a local clinic.
Okay.
And then I explained my problem to them, and they didn't do anything. They just tested me and they said, no, you are pregnant, like you are not pregnant, like you are saying that you also tested, you are not pregnant. And so I said to them, what could be the problem maybe? They said to me, maybe you are menopause.
Okay.
Yes, and I didn't do I did not go for test for the cancer because then I was not informed enough. But I'm listening to you guys now, and I wonder what maybe this is also a cause for concern because my breast is still painful even now.
Yeah.
Both of them.
Sis Mathapelo, so after you gave birth, but you know, when you told them ukuthi the pain is still persistent and you're still seeing that liquid in Nansika with that looks like blood or pus.
Nothing was done.
Okay, but when's the biopsy got? Or remember?
No, I was not pregnant. I thought I was pregnant.
Okay.
I wasn't pregnant. I thought I was pregnant because when coma some liquid in my belly.
Oh, I see. Okay.
When I tested myself at home twice, it was negative. I then decided to go to the local clinic.
Okay.
They also tested, and then they said it's negative also. But I told them my problem, and then they said to me, maybe you are menopause. Hence, the liquid and the things.
Okay,
but now I'm listening to you guys and
You need more information. Okay, Sanasab. It's indeed pendule first before we run out of time. Okay, so we've got 2 cases here, Doctor. Umatapelo is 42, Usis Virginia in Cape Town is 52. Umatapelo, uyasizu story sakhe. She even thought she was pregnant. But doctors are not picking this up, Doctor. How are we supposed to then deal if you're going to go with the symptoms and you're not getting diagnosed?
Hey, inzima. Lesithetha nosisodwa ukuthi I think ngamanye amaxesha i-system yethu iyabafeyila abantu bethu as well because abantu bayaya benengxaki bangancedakali.
Yes.
Ngoba xa ujonga abantu babini usis Virginia nosis Matapelo banenkinga that needs to be checked.
Yes.
You can't just leave them alone. And the inkinga is that bazawuloko besiya by the time somebody intervenes
it's going to be too late.
And uthola ukuthi umuntu has been in the system and has been trying to get help. But I told you so.
Sizodwa, your final seconds. Please close the show for us.
You know, I would highly recommend that our healthcare workers at the primary health clinic to be trained on the top 5 cancers.
All right.
I think that will also help, you know, to make sure. And also, can I just say that the public, can we not stigmatize the people who have cancer? Ngoba i-late diagnosis ivela ngokuthi abantu kuthiwa una evil spirit you
usothinta kwezinye manje siyabonga ke manje. Ladies, thank you so much for joining us for that information as well. Clearly we need another follow-up of this show and looking at other various cancers. Siyabonga kakhulu nina emakhaya with your participation, your calls and everything. Thank you so much. Let's see you next week for another live consumer affairs discussion from me, Jali, and my lovely guest in studio, Nisale kahle emakhaya.
Hallelujah.